I was at my brother's friend's house, and I was trying to feed their dog, and then it just bit me.
It was a very scary situation because we didn't know for sure if it was just going to be stitches or what it was going to entail.
The emergency room was really concerned about it because they were concerned that there might have been injury to the facial nerve, which is responsible for movement in the face. They were also really concerned that he might have ended up with injury to his parotid gland. He was going to require some revision of the scars, meaning that I would have to actually remove some tissue and rearrange the tissue on his face in order to get all the parts together because there was tissue missing. Thankfully, it was one of those scenarios that I had been trained for when I was at Mount Sinai in Manhattan. We saw a lot of trauma, and of course when I was in Afghanistan I saw facial trauma all the time. That was what I spent a lot of my time doing, was repairing facial trauma and putting people's faces back together. If I wear my Batman belt buckle or my Superman belt buckle or Yoda or Darth Vader or something along those lines, for a lot of kids that's what they remember. And I think that that's really important because you don't want a child to remember the unpleasant parts of the visit because then they come in scared and then it's harder to examine them, and generally speaking you don't want to be remembered as the person that caused them pain. You want to be remembered as somebody that helped them get better.
Even in Norfolk, Nebraska, we are in incredibly good hands. I had no issues whatsoever. We felt very confident.
It's wonderful to see him again a year after his injury to discover that he doesn't need any further surgery, and he's very happy with how things turned out. And I, for one, am really grateful for having had the opportunity to take care of him and having had the opportunity to get the training that I did so that I could take care of him.